Hello, welcome to my podcast. Here you are again on my podcast and my YouTube channel. Thank you for being here. Today we're going to talk about chronic pain. And why should we talk about that? I have a very special guest today with me, but we should talk about chronic pain because it is associated with suicide. Actually, we're going to talk about this and he's going to give us all the stats and all the numbers. But we know that those with chronic pain, they have higher risks of dying by suicide. The suicide rates are actually higher, and for obvious reasons, and we're going to cover all of them today. But more than talk about what chronic pain is, we're going to dive into solutions, because that's what we thrive to do here, right, David?
Yeah.
We want to help people who experience chronic pain, how they can maybe broaden their perspective on what chronic pain is, how to deal with it, some very specific skills, because David knows all about chronic pain. He actually, unfortunately, he had an accident in 2007. A woman who was driving, she was on her cell phone. Just correct me if I'm wrong. I'm going to tell you a story now. But she hit him really hard, and I think the truck just went, flipped a few times. Since then, he's had a dozen surgeries, 2 metal hips, plates, screws in his spine, and also he has, because of one of his surgery, unfortunately, he contracted this rare neurological disease called CRPS. It's complex regional pain syndrome. It's also known as the suicide disease. So, David, I'm so sorry you have to go through all this, but you are one of those people who turn your pain into helping others. And that's why I have you here with me. Thank you so much today, David Hall. He's my guest. He is a certified health and wellness coach, and he specializes in treating chronic pain. And that's what he does. He talks to people who go through what he goes through every day, giving him tips. And he also has a podcast, and we're going to talk about that too. So, David, that's a long introduction. Thank you so much for being with us.
You did it extremely well. Couldn't have done it better myself.
How are you doing? I know he just had a new surgery, 2 weeks ago?
Yes.
And,
Yep.
and what was it for?
My CRPS spread several months ago, and it was located just in my left foot. And for some reason, unexplained to me, or not understood by me, it spread to my right leg and my thigh. And there has, since my first spinal cord stimulator implant, a new type of device called a DRG stimulator, which is dorsal root ganglion stimulator, came out. That's a more focused treatment. So I went through a trial. The trial was successful, so they did an implant. And as time goes on, it not only reduces my pain, but it also has the capability to provide a restorative therapy. So if the winds are at my back and things are going well, that could restore the nerves to the point to where one day I don't need it.
Mm-hmm. Well, good. And I hope it works with you. Let's start by talking about the difference between acute, because this is something that I don't know, and maybe some of my listeners don't as well. What is the difference between acute pain and chronic pain?
Well, the biggest difference, speaking generally, is acute pain serves as a warning. So if there's a threat to the body, you touch a hot pan or you touch a cactus, whatever, you'll get a message to your brain, and on the ascending pathways, the brain will process that pain, and it sends a motor response down to stop the threat. So in the case of something that's hot, you react, and it seems instantaneous, but it's not. So in that context, acute pain serves a useful function. You'll have acute pain after a surgery, and so that pain helps you protect and guard yourself so that you don't cause further injury. Chronic pain, however, serves no useful purpose. So if acute pain is not treated aggressively and appropriately, it can morph into chronic pain. And there's a process where the brain overreacts and it spins up that pain cycle and it actually creates pain. And where we experience pain in our body is not necessarily where it's created. So nociceptive pain is like pain at the site. So you burn yourself, that's nociceptors that are responding. However, with chronic pain, the pain is entirely in the brain and in the spinal column, and it's just spun up. So typically after 12 weeks of healing, your tissues are healed, they're restored. There's not going to be any more improvement. But if you still have pain after healing, that's chronic pain. And
Mm-hmm.
it's and it
And that's because the brain doesn't understand what's happening. It kind of gets out of whack.
it overreacts.
Why does that happen?
Well, the process is the brain naturally amplifies pain as a protective mechanism. And for some reason, we don't completely understand it. The brain does not deactivate. So those nociceptors, even though they're not firing anymore, the brain spins it up. So for example, and part of it could be our life experience. So there's a funny lecturer, a professor in Australia that was walking in the outback and he felt a little scratch on his leg. Well, what happened is he got bit by some dangerous spider and it almost killed him. He was in the hospital for many, many weeks. And so later on, fast forward several years, he's walking in the outback and he feels something on his leg, and all of a sudden he experiences all of this magnificent pain. And so he looks at his leg, and it's just a little scratch. It wasn't even a spider bite, but yet he had this giant experience of excruciating pain. Well, the brain created that. But when he looked at it, oh, it's just a scratch, he was fine. So it's funny how the brain processes the information, because pain is processed in the same areas that our emotions are. And so emotion, that's why emotion plays big into our perception and our response to pain. So with chronic pain, what happens is those parts of the brain that spin up pain, they don't turn off. And if we could figure out how to turn those things off, we can eliminate a lot of pain. And there are some medications that can reset pain receptors. And ketamine is one of those. So before I go in for a surgery to prevent CRPS, or CRPS, also called CRPS, to keep it from spreading, I go in for what's called a ketamine infusion. And that helps reset pain receptors in the brain, theoretically.
Mm-hmm.
Uh,
Mm-hmm.
but we don't really understand why chronic pain exists. We treat the symptoms, but
Mm-hmm.
that's why opioids don't work with chronic pain. They work
Yeah.
with nociceptive or an acute pain, but they're really ineffective for chronic pain. They just make you don't care that you have the pain. It's still there. You just don't,
Yeah, yeah.
drug down.
And I love that you mentioned that it's the same area that where emotions are processed. And this is actually interesting because we talk about painful emotions, right? And say it hurts because it actually does. It physically hurts because it is the same area. So talking about emotions, what is the importance of emotions in pain management?
Um, One of the things that'll make your pain worse are negative emotions, especially anger. So when you
Mm,
respond, if I get really frustrated and angry, it won't be long before my crypt split starts to flare, and that just amps up. And so it's really incumbent upon people with chronic pain to really be mindful of what's happening in the moment and to understand what they can change, what things can change, and those things that they can't. So in the final analysis, you can break chronic pain down into three areas. The things that the doctor can do, which is about 30% through medication and pharmacology. Then there's 30% that the patient can do through physical therapy, mindfulness, desensitization. And then the other third, you're going to have to live with unless you can retrain your brain and unlearn pain, which is possible.
Hmm.
That's a big part of treating CRPS is how to
Yeah.
desensitize and retrain.
You mentioned anger. What other emotions are associated? I would think that maybe guilt when it's I don't know, self-inflicted, maybe someone got into a car accident because they were talking on the phone, right?
Yeah, guilt is a big one. Guilt a lot of times for chronic pain patients, especially men, because they feel that I can't do what I used to do for my family, especially if they're taken out of the workplace, they'll feel
Mm.
guilt. Um, they'll confuse that with shame, which is sad. Um, Depression is of course a big one, and grief. Grief is huge, especially because you experience those losses. So, so your question is probably the most important question you asked, because those emotions all feed into chronic pain,
Mm.
and it's huge. So people that are in chronic pain really are in a constant psychological battle with themselves to maintain some level of homeostasis or balance so that they.
Hmm. And that's where the grief comes in, right? Because they're always trying to. I was thinking about this and how hopeless you might feel when you have chronic pain, because you look at the future and you say, wow, this is going to be with me forever, right? And you look at the past and you say, wow, I lost the life I had. So it's a huge loss. And as you said, that's grief, right?
Yep.
And how important is it for them to, I mean, what are ways that you can actually live with chronic pain,
Well,
psychologically speaking?
the best way to do that is find a practitioner, a pain specialist that takes a multidisciplinary approach. And unfortunately, most pain specialists that are out there are pill pushing needle jockeys because that's their education. That's not a negative comment. It's just the way that it is.
That's how
Um,
they're trained,
that's how
right?
they're trained. Which,
Pain, and also how society sees pain, any kind. And we're not talking about physical pain, we're talking about pain, period, right? If you're going through grief and your audience goes through grief, you go to a psychiatrist and you ask for pain for depression, right? It's all about the pill.
yep. And that's why in the recent GAP study that was done to help curb this opioid crisis, um, is the biopsychosocial model, which is nothing new. It's been around for decades, but its implementation has been slow in coming. So unless you go to like a Cleveland Clinic, John Hopkins, Mayo Clinic, or Barrow Neurological that has a multidisciplinary approach to the brain and the nervous system, it's really difficult because just taking a pill for the pain doesn't address all the psychological aspects or the social aspects of pain, because a lot of people that are in chronic pain, they isolate themselves. They're which is it's hard on the brain because we're social creatures. So a lot of these things just feed forward and just promote the spinning up of that chronic pain. So
Hmm.
making sure that you have a multidisciplinary team, and if you don't go to one of those clinics that has that approach, you've got to do it yourself. And
Hmm.
that's why learning how to interview specialists becomes a skill that you have, because just like there's good doctors and mediocre doctors, there's good psychologists and there's mediocre ones. And the thing is chronic pain is a specialty,
Uh-huh.
but it reaches so far and it crosses so many domains that that might be a challenge. And that's why we should look to your profession for guidance and leadership how do I find this balance? And
Mm-hmm. Mm-hmm.
I don't know what the training extent is for psychologists in the area of chronic pain, but I know in the medical
The medical field.
professional,
Yeah.
um, veterinarians get more training in pain management than do human doctors.
Wow, I didn't know that. But I want to back up a little bit. Why I know that you're going to give us some very specific tools on how to deal with this and even the questions to ask, just so you know if your doctor is, if they know what they're doing in terms of treating chronic pain. But let's back up a little bit. And you mentioned that isolation is key because you get into the cycle. I think that's what you said. You get into the cycle because pain, it does put you in, that's physical pain, emotional pain. It does keep you inside your head and yourself. Now you become the focus. We all know this. I mean, if you have a toothache, as you know, a bad toothache, you can't even talk to people. It's all you think about. And I can imagine if you have chronic pain, and sometimes it's the whole body aching and in horrible pain. What create? I think that's what you said. You get into this cycle of, okay, you are alone with your pain, and then you keep yourself away from people, and that doesn't help, right?
Right.
Yeah. Does that feed into the pain too? Do you have any research that shows that isolation maybe makes it worse?
Well, when you're isolated, you start having cognitive distortions. You start believing the stories that you create,
Mm.
right? And so, in some cases, as far as social interaction, my wife Debbie and I, we had theater tickets, and we had looked forward to this show. But I felt so horrible. There was no way I could just sit in a theater for 2.5 hours. I just didn't have it within me. And
Mm-hmm.
I was having a flare that day. So that's one example where you become socially isolated. A lot of times you don't feel like, people are going to ask you, hey, how are you doing? And it's a social courtesy. They don't really care. They don't want to hear you complain. It's more of a social greeting, which is fine. That's acceptable and it's understandable. But people with chronic pain, they get tired of hearing themselves tell it. And so you just withdraw because it's easier. It's a
Mm-hmm.
path of least resistance, if you will. But that creates the opportunity for cognitive distortions that
Mm-hmm.
that we believe.
Yeah, and what are these thoughts that you get into? What are the main ones that are typical of chronic pain sufferers?
No, I just don't feel like being out in public. I don't feel like interacting, and it's just easier to be alone because
Or nobody understands, right? Or nobody understands because the
and,
the pain I feel is mine, right?
and,
And only I understand it.
and that's the importance of chronic pain support groups, is finding people that you are amongst your own that can empathize with you, that they reaffirm or validate your experience as being real. And that's a big problem because a lot of people, oh, you look fine to me.
Yeah,
And
that's the thing with pain.
I,
You don't know, right? It's
you,
internal.
you don't
Unless
always
you
know.
see, unless you see a cast and you go, "Wow, what
Yeah.
happened?" Right?
Well, one day I was getting groceries and I parked in a handicap spot. I was having a rough day, and I rarely use handicap spots, but that was a day that I just really needed one. And I get out of my truck and I'm walking in the store, and the person said to me, I can't see that you have a handicap. And I said, well, I can't see that you have a brain, but you have one. I just can't see it.
Oh my God, that's a good answer, though.
Well, I didn't feel good saying that afterwards. But a lot of people, if a person has trigeminal neuralgia, I know of this lady. She was a model, and she had
Wow.
trigeminal neuralgia, but she could not wear clothes that would brush against her face
Oh my
because if
God.
it did, it
Hurts
felt
so much.
you know, it was incredibly painful. So you
Yeah.
never know.
You
You
never know.
you
Yeah.
you don't know. But
Mm-hmm.
having the opportunity for a chronic pain patient to be in a support group, which I highly recommend,
Mm-hmm.
um, you find that there's a kinship and there's an understanding that validates you that you're okay, you're going to make it through. And
Mm-hmm. Mm-hmm.
hopefully you've got group leaders that can give you positive strokes and encouragement.
Mm-hmm.
And just the knowledge of knowing that you're not alone uh,
Yeah.
lessens the blow. And I can't really explain why, but uh, for some of these people, the only social interaction they
And
have.
it's connection, right? That's the connection piece
Yeah.
that's missing many times in the life of those who have chronic pain. David, let's educate my audience on what happens in the brain. You say that it changes the brain's activity, the chemistry, the structure of the brain. What happens in the brain when you have chronic pain?
Yeah, let me spin over to some of my notes. So there is what I call the triple whammy. Um, and this is where chronic pain, it actually changes the brain in three ways. One, it actually changes the brain's structure. So neurons that fire together wire together. And they've seen from functional MRIs that the shape of the brain actually changes with chronic pain. It also changes chemistry. So there are neurotransmitters that create those connections in the synapses of the brain that sometimes they're overactive. And
Mm-hmm.
so drugs like gabapentin will be prescribed that modify these calcium channels. So the brain chemistry changes, and also brain activity changes as a result of chronic pain.
What does that mean, brain activity?
Um, we know that patients in chronic pain, their sleep patterns change,
Mm.
and that's because there's this constant firing that's going on in their brain. And so when you don't get good restorative sleep, it affects memory.
Mm-hmm.
That's just one of the things. Um, but all of this can be counteracted because the brain is incredibly neuroplastic.
Yes, that's the hope word, isn't it? Neuroplasticity. It sounds complicated, but basically for me, neuroplasticity means hope. You can change and rewire your brain, right?
Absolutely, absolutely. So what happens is when these nerve fire nerves fire, you get bradykinins, histamines, prostaglandins. All of these are chemicals that start this rapid exchange in what are
Mhm.
called synapses. They're little gaps. And so it's basically an electrochemical reaction that takes place from the nociceptor in the case of acute pain, the nociceptor, let's say, is in your skin. When it goes up to your brain, all sorts of these um, chemicals dump, and it dumps pretty quick. Uh,
Mhm.
but the brain chemistry changes can affect you in areas of depression.
Mm.
Uh, and I don't know, I'm not familiar with that aspect of it. I know that some of the medications that they prescribe for depression, as well as anticonvulsants for epilepsy, they found are also good in chronic pain management. And all of those things work in the brain, but they don't work on dopamine receptors.
Okay.
And that's a good thing because when, and this is a little, I'm kind of taking you on a little side shoot here, but opioids, the reason that they don't work is because your brain wants to keep this cycle spinning.
Mhm.
So for dopamines you take, it's going to create more pain pathways. So
Oh,
when you
okay.
stop taking those dopamines, your
And you
pain
feel
goes
more
up.
pain, of course.
You feel
Oh,
more
I didn't
pain.
know that.
And that's why most competent pain specialists try to get you off those opioids as quickly as
As
possible.
quick as yeah, yeah. You were saying that some medications for depression, they actually work on pain. And I actually had this experience myself. When I did have depression and I went to the doctor and I was medicated, I had back then, and I had no idea that that was related to the depression, because you go online and you look at all the symptoms of depression. At least back then, I didn't see anything mentioning pain, physical pain, and I had been having this horrible back pain, and it was hard for me to sleep. And of course, it becomes even worse because you don't sleep. It's this cycle,
Right.
and I had changed my mattress. And when I talked to the doctor, I didn't even mention because I didn't know it was related, but he asked, said, "Are you feeling any physical pain?" And I said, "Well, now that you ask, yeah, I've been having this back pain for a few months." And he said, "Yeah, that's related to depression," because that was important for him to know which kind of medication to give me. And I'm telling you, it was almost magical, David. In
Mhm.
2 days, I had no more back pain. And we know that medication for depression takes weeks, right? But for the pain itself, it was automatic. And I
It's
was so
very quick.
impressed and surprised myself. It's, oh my God, I didn't know this was related to depression.
And that's why a good pain specialist is going to ask you questions about
Mm-hmm.
lifestyle that are
Yeah.
outside just the biological aspects of pain. And are you getting out? What kind of exercise are you doing? What's your emotional state?
Mm-hmm.
What would your spouse say about you as far as
Yeah.
pre and
What's
post
your social
pain?
support,
Yeah,
right?
and they
Yeah.
start asking you those questions. And that's how you know that you've got a good pain specialist, is because they're not looking at just treating a symptom, they're
Mm-hmm.
treating the whole patient.
Yeah.
And
That's a good tip. That's a good tip.
we're getting more into functional medication or functional
Oh.
medicine, where we're
Mm-hmm.
now looking at diet, anti-inflammatory. So
Mm,
I've had to
yeah.
give up some of the things that I really like.
Yeah. Give us examples because my listeners may have to give up the two.
Um, Red meat is a big one.
Yeah.
Red meat is,
Really?
yeah, it's an anti-inflammatory. The two diets that I would recommend for people that have chronic pain is either the Harvard diet or a
Mhm.
Mediterranean diet. Both,
Mediterranean is the best because it has a lot of omega-3, right?
it's got a lot of things. It's got a lot of
Yeah.
omega-3s. It's got healthy plant-based fats,
Mm-hmm.
so you can consume higher amounts of fat, light on red meat, light on cheeses, um,
Mm-hmm.
but you'll feel better. So you got to choose.
Yeah. Yeah.
Do you want pleasure for a few minutes at the dinner table, or do you want to feel good for hours and days?
For hours and hours and even
Yeah.
sleep, it affects sleep
Oh,
too.
hugely.
I want to hear you on something that I was reading. And by the way, we're going to talk about your book. He is finishing a book. It's going to be released in January. What is it called, David?
It's called striving to thriving.
Yes, I learned, I only read one chapter because he sent me, but I loved it. So I highly recommend the book. But you say something about pain that just sparked my curiosity. You say that pain sometimes is a learned response. What do you mean by that?
Um, a lot of our experience pain comes to us by the culture in which we were raised.
Mhm.
So, for example, growing up, I was raised in a German family, and falling down, bruising, whatever, is just part of life. And so, uh, when I look at how I raised my son versus some of the helicopter parents, it's funny because you see a kid out on a field fall, and they look back at the parent, and if the parent goes, "Are you okay?" Well, then the kid goes, "Oh, I must not be okay." But if you ignore the kid, be quiet, go play, they know that they're okay, and that bumps and bruises are a part of life. So, um, and I hate the word catastrophizing because it's misused quite a bit. But a lot of our pain that we learn is just the fact in our culture we want to feel good. And
Yeah.
you know, my hair hurts, I need a pill. My teeth itch, I need a pill. So we look for these solutions, and they're really not solutions. And a lot of times they have more side effects really than what they're worth. But um, learned pain. is just a lot of cultural norms. And you can see it in different cultures. And the more westernized and the modernized uh, we've become wimps. And bumps and bruises are a part of life. And if you if you focus on your pain, you'll make it worse, guaranteed. But if you can somehow learn to ignore it, then you're better off. So one of the things that my pain specialist, Dr. Lisa Jo Stearns, taught me is one of the best ways to overcome the deleterious effects of pain on the brain, as well as minimize pain, is use your brain, activate it. So I like to write, and I decided to, because of her encouragement, start the book. But I also decided to learn bass guitar. And it's
Mhm.
because it uses hand-eye coordination. It requires me to learn something new. And learning something new is something we should always do to preserve brain health anyway.
Yes. Hmm.
But ironically, when I'm playing bass or I'm writing, I also like to paint. Um, I'm pain-free because I am so focused on what I'm doing that the brain can't process that pain because it's too busy doing other stuff. And
Uh-huh. So use your brain because the brain is going to work anyway,
yeah,
and just guide it elsewhere. Is that what you're saying?
yeah, the brain can only do so much.
Hmm.
So, for example, when you sprain your ankle, what's the first thing you do? You grab it.
Scream, scream.
Yeah, but
Second, I grab it.
yeah, but then you grab it and you start rubbing that foot, right? You
Hmm.
start
Yeah,
rubbing. Well,
yeah.
why do we do that? That's because the sensation of rubbing it, those signals are louder than the pain.
You trick your brain.
You trick your brain.
Yeah.
So a lot of it is just outsmarting your brain. Um, also,
Oh, I'm going to mention something that only the women will understand. Waxing. That's what we do when we wax. So let's say you're waxing your arm, right? You wax, the moment you pull it, you're going to rub it really fast, and that distracts you from the pain.
that's right.
The good people who do waxing do that immediately because they know, because before you feel that horrible pain, they rub it. This is the same thing. Yeah, it distracts and you feel the rubbing. So, okay, it's fine.
Yep.
So that's a good tip. One is distract yourself and try to get out of your mental narrative of pain, right? Try to unfocus. I don't even know if this word exists, but try to just get your brain out of that loop.
Yep.
What is another thing that helps? Let's give them more
Another big one, and you'll probably be able to explain this better than I can, is gratitude. They
tools.
found that doing gratitude writing produces enough dopamines in the brain that are actually pain reducing.
Hmm.
And so having an attitude of gratitude, and people that do wellness writing, which is something that I am such a huge fan of, um, uh, will do as much for pain reduction as popping some opioids. So
Wow.
having an attitude of gratitude has several benefits. I don't understand the chemistry of the brain, so I won't even try.
Well, you just explained it. I'm not getting into that because you explained it really well. Yeah. And it also broadens your mind, right? Again, it gets your mind out of the pain circuitry.
Yeah, and one of the things, if nobody gets anything else from me in my coaching sessions with them, I have all my clients do writing. And the neat thing about writing is it slows down the brain and allows you to focus on other things besides your pain, things that are really important, things that are relative to your core values. And writing is a great way of interrogating your own thoughts.
Hmm.
And when you get it out on paper, it it changes. There's something different because now you can look at your own thoughts sort of as a disinterested third person and then write about that. Um,
Hmm.
so that can be extremely cathartic. Um,
Hmm. So that helps too.
Hmm.
One more tip, and then we'll finish giving them orienting them in how to find a good either doctor or psychotherapist or whatever that will
Okay.
really tackle pain.
Um,
What else helps?
People have told me, um, I used to go to this support group for CRPS people, and people would say, "Oh, wow, you have CRPS," and I would say, "I have CRPS, but CRPS does not have me. I refuse to be defined by my illness."
Mm-hmm.
And sadly, and this breaks my heart because, and this is a big part of me coaching people in chronic pain, is to be able to isolate the person of who they are from their pain. Because too many times people, their identity becomes wrapped up in their pain.
Same
And,
thing with mental illness. Same thing.
and it's
What? Tell me
frustrating.
something about yourself. They'll say I have depression. Yeah.
Say,
Same thing happens with mental illness. You'll ask someone, and tell me something about yourself, and they'll say, I have depression.
and that's their identity.
Yeah.
And once that becomes their identity, then they start nurturing that versus overcoming it. And that's the
Mm-hmm.
difference between moving from striving to thriving.
Mm-hmm.
It's a stubborn
Mm-hmm.
refusal to be a victim to your pain.
Okay, so recapping, just fill in the blanks, okay? What exercise is important, connections, get out of your mind and connect with people. Don't be alone, don't be isolated. Watch what you eat. Try distracting your brain and occupying your brain with other activities. Writing helps. Be
learning
care.
something,
What's the other?
learning something new that uses both,
Learning something
both
new.
your
Yeah,
hands and your
both
brain.
your hands, and that's important because that's stimulating your brain on both sides. Bilateral stimulation, we call
Exactly.
it. So that's very important. Something manual helps. Okay. Anything else? Did I forget anything?
No.
And if that is not enough, just call David. He's a coach. He'll help you. Tell me how to find which questions should they ask when they're searching for someone who's going to help them with pain management.
Well, one of the things that you want to ask them is what is their experience and their philosophy of how to treat pain. So if they say, well, I go after the symptoms, I say, well, thank you very much for your time. Have a good day. You need to look for a person that is going to look at you in your entirety. So let me go back to some of my notes.
Yeah, let me just say something. Yeah, you said, well, I'm going to treat the symptoms. They may not say that, but they will say, well, we're going to try different medication and different doses of medication until we find what works for you. That's saying I'm going to treat your symptoms, right?
Yes, and that approach typically winds up being an horrible frustration for the parent, for the patient,
Uh-huh.
because there's so many things that they can try, but if they're not looking at you in a holistic manner, it's gonna it's like throwing darts at a dartboard and hoping that you hit the bullseye,
Mm-hmm.
and that's just it doesn't work. So hold on a
Mm-hmm.
second. So with the practice that I participated in, um, the support groups were mandated,
Mm-hmm.
and um, patient education was the biggest and most impressive part of the practice.
Mm-hmm.
And evidence has shown that patient education in itself reduces pain
Mm-hmm.
because there's not so much the fear of being in the unknown.
Okay.
Okay. So some of the questions that you want to ask a doctor, um, Are they in good standing? Do they have any outstanding complaints against them? You definitely want to know if they're in your insurance network. If not,
Hmm.
that can be rather expensive. There's the practicality of how easy it is to get to them. Um,
Because it can flare up anytime, right?
well, you can flare up, and if you're out in a rural area in the middle of Kansas and you're an hour outside of Kansas City, that's something you're going to have to take into consideration. Um, is the practice a specialty? What do they specialize in? What are their competencies? So by training, a lot of pain specialists are anesthesiologists. And that's a good thing because they understand delivery mechanisms of drugs and how they interact with the brain. Your general practitioner won't have that expertise.
Hmm.
But by definition, if they're prescribing you opioids, which they're licensed to do, um, they're practicing pain management, which is a big part of the opioid crisis that we're seeing now. Um, and the guidelines that came out were treated as gospel. And sadly, they handcuff some pain specialists that are adequately trained, and patients
Yeah.
couldn't get
A lot
them.
of people are suffering because of that, right? We
Uh,
understand uh, because of the crisis and everything, they were overprescribing in all these places that lived off of prescribing opioids, but there are a lot of people suffering for that. Yeah.
Right, and so the unintended consequence of that is when people couldn't get drugs to relieve their pain, they went to the streets, and now we're seeing an increase in fentanyl deaths.
Yeah. Yeah.
So,
It's really
so
sad. Yeah.
it, the response was a swing in the wrong. It was well intended, but the swing went in the wrong direction
Yeah.
because it
Yeah.
handcuffed pain specialists that understand delivery mechanisms,
Mm-hmm.
and that's the wrong way to go.
Mm-hmm.
But ironically, I remember coming out of one of my surgeries, and I was given a bottle of Norcos. It's like 90 pills in there. Well, post surgery shouldn't last. You shouldn't be on opioids more than a week at
In a
most.
week, yeah.
Yeah,
After a week, that's when the addiction kicks in.
yeah.
Well, David, tell us how to find you. And before we finish, I would recommend your podcast, Striving to Thriving. It's a very good one. And if you do have chronic pain, I would really recommend that you listen to it because, you know, he gives a lot of tips. He interviews people. Yeah, where can they find you?
My website is strivingtothriving.com. My phone number is there. I'm easily reached. Um, it's it's a coaching website. I do not provide psychological counseling. I'm a
Hmm.
coach. I don't make recommendations as far as drugs or prescriptions or anything like that.
Of course.
What I do is I help people rediscover their their hero that's inside them
Hmm.
and walk with them. And that's really what most pain patients need is to help and guidance in how to find the specialist. So back to your question of what to ask doctors, um, ask them important questions like, what's the source of my pain? What are treatment options and therapies? What are the risks? Sadly, a lot of doctors will write prescriptions, but they don't cover the potential side effects.
Hmm.
And I had that happen, and one of the side effects of one of the drugs caused my asthma to flare, and I wound up in the hospital.
Wow. No, and then you
You
went,
know,
you die because you can't breathe. Yeah.
yeah.
And that's
So,
part of this, and that's part of your choice, right? Your choice mechanism. You have to know the pros and cons. So it's
mhm.
important to know. Okay.
And the benefit, and it's a mixed bag, is you can do a lot of good research on the internet, but leave the diagnosis to the professionals.
Hmm.
Don't diagnose yourself. It's
Where
like the
should they
old
go?
saying.
That's a good point. Where should they go online? What are the resources that you recommend?
Well, there are many good websites that are specific to specific conditions.
Mhm.
So, like, there's a site for those people that have CRPS, chronic pain. There are those. The U.S. Pain Foundation is a great website
Great.
for general
Okay.
consideration. The CDC website that your tax dollars are paying for is also another good site. Um, but you want to go to sites that are nationally recognized.
Very careful with that. Yeah.
Got to be very careful with that. And I don't put a whole lot of stock in Facebook or a lot of the information that's out there. You know,
Well,
the good
unless
news,
it's a group, right? Because they do have good support groups there.
they do have good support groups, but you still need to separate the wheat from the chaff. So
Yeah.
with chronic pain patients, we tend to be real negative. It's
Yeah.
just the way it is.
Yeah, of
And so
course.
you
Yeah.
want to guard against those kind of things. And you want to, second opinions are great. And if you can get referrals from somebody that has gone to a doctor, to me, that carries a lot of weight.
Yeah, of
And
course.
my background is in biomedical device engineering. And so when it came time for me to get a spinal cord stimulator, I did my homework. I wanted to find out what technologies are out there. And I made a few phone calls to people that are in the industry and what's the best device out there and who's the best person to put it in? Because just because you have the technology
Yeah.
doesn't
You
mean that
still you still need the human hands. Yeah.
the person that puts it in, it's like a race car driver. Anybody can drive a car, but not
Yeah.
everybody can drive a high performance vehicle. So those are the kind of
Okay.
things you need to scrutinize.
Thank you, David, so much for your knowledge and for sharing that. I'm sure a lot of people will be helped. And do reach out if you need more guidance. That's what he's there for. And thank you. And I hope you are okay and
I'm
you
good.
heal from your surgery. Okay. Have a good
You
day.
bet.
You
Take
stay
care of
safe.
yourself. God bless.